A new study at Washington University's School of Medicine about long-term consequences of COVID-19 is now getting national attention. News 4's Damon Arnold spoke to the researchers about the increased health risks.
Our findings suggest that long COVID can affect nearly every organ system.
For the past 6 months, Assistant Professor Zayad Al-Ali of Washington University and his team have been monitoring some of the first people in our area to get COVID-19.
So we've known for a while now that some people with COVID are still reporting fatigue and shortness of breath and cough and other manifestations well beyond the first 30 days. So we started thinking, are some people with COVID are going on to, do they have long-term manifestations?
Their findings showed an increased risk of death and quite a number of other serious illnesses.
For those who had severe symptoms and were hospitalized, are they more at risk of having complications in the future?
You are absolutely correct. Yes. So that we saw a risk gradient in the sense that the risk is there and it's not trivial. It's significant and not trivial in people who had mild disease, but it increases substantially in people who really needed to be hospitalized, and even more so in people who were hospitalized and needed ICU care.
Dr. Al-Ali says even the least severe case has a greater risk of serious illness than someone who hasn't had COVID.
It can affect the brain, it can affect the heart, it can affect the lungs, it can affect the kidneys, the liver. We see increased risk of mental health disorders.
Making sure your primary physician stays vigilant during your checkups is one way to combat the risk. Another is making sure you pay attention to how you feel.
We should be vigilant and be prepared to deal with long COVID patients. This is not going to be a small subset of the population. It's going to be at least 3 million people in the United States who will need long-term care.
Reporting in St. Louis, Damon Arnold, News 4.